Oh, to consent to be recorded now.
Does everybody get that? Okay.
Wow.
Yeah.
Okay, you're now live.
Thanks.
Perfect. Give us another 30 seconds to have all of our peoples. All right, then I will go ahead and call the meeting to order. So Sarah was just commenting earlier, there was a little bit of confusion between exactly which meeting that this was. So we have the CJCC Executive Committee, which is a smaller set by bylaws group. And then we have the Operations Committee. And the intention was for this to be an Operations Committee meeting because this executive committee only needs to meet prior to the quarterly CJCC meetings. So anyway, but it looks like you all kind of accommodated and figured that out anyway. So, or mostly, so we're, so this is actually an operations committee meeting. It was in the announcement, it says executive committee, and then in the agenda, it's operations committee. So it got confused, but we'll clean it up for the next time. So I will, in light of the fact that we have some new people present, I will have you, Sarah, maybe call the roll and give people an opportunity to introduce themselves, who they are and what they're representing.
All right. Okay, so well, we start with you. I think folks know who you are. So Chris Corpla, chair
and the
of our
chair of this
CJ.
committee and the Human Services Director.
Yeah. Then we've got Paul Miller, our county manager.
And sower of chaos.
The who?
The sower of chaos.
Sower of chaos. I thought you were the reaper of chaos.
That too.
Okay.
We got Aaron Chernahouse with the Department of Corrections, the field supervisor for Menominee office. We got Katie Shalley with the clerk of courts office. We got Chief Atkinson with Menominee PD. We've got Judge Peterson. Then we also have County Board Chair Dave Bartlett. So those are the standard members. And then we've got some special guests today. So we've got our two new judge-elects. We've got Christina Meyer and we got Luke Wagner. So welcome. Super glad you could join us today. And then we also have our program coordinators. We've got Janae Brantner with Treatment Court. And we've got Courtney Wolf with our Family Treatment Court. And we're going to hear reports on those programs in a little bit. And then it looks like we also have Lindsay Field. She is our integrated treatment specialist working with both of those programs. Looks like Caitlin Engel with public health is on as well. And then we've got Krista Vind with IT support. So did I get everybody? I think so. Yeah. And then we do have a couple others that would typically be part of this group. Our district attorney, our sheriff, and then Judge Smeltzer. So those folks are not present today, or at this point anyways.
All right. I will entertain a motion for approving the minutes of the April 29th meeting. Dave? Chair Bartlett?
I'll second.
Katie, a second. Any discussion, additions, or corrections to those minutes? Otherwise, all those in favor of approving them signify by saying aye.
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 Opposed, same sign. Motion carries. All right. So we set aside a little bit of time just to review. Last month, we talked about the structure to these meetings, the operations committee meetings, and Sarah, primarily Sarah, with a tiny bit of input from me, put together a schedule. So this operations committee will become the oversight kind of monitoring, maybe I don't mean to decrease its importance, but anyway, entity to a number of CJCC and related functions. And so Sarah put together a calendar of that. Sarah, were you going to share that?
No, I wasn't actually,
Okay.
but
All right.
we do have a calendar of the 8 oversight areas. So, and we're gonna twice a year kind of have them in front of this group to get an update. So.
Yep. So you will see the first of those 2 areas today with the treatment court and the family treatment court. And then the additional items are laid out then in today's agenda, moving the consideration of actions to closer to the top of the agenda so that those get accomplished and aren't left, because those would be the more important of businesses that we're doing. The review or the reports of the oversight areas. And then 2 kind of, maybe they will ultimately sort of mold into one, but 2 opportunities, I guess: local challenges, collaboration, and priorities, and then emerging trends and opportunities. And honestly, in my mind, how I separate those are the local challenges and collaboration piece is really those things that have been the substance of the CJCC, or areas where we are seeing that we would like that to be. And then I see that emerging trends and opportunities as maybe a bit more global look at some of the things that might be out there that we need to be tending to on a larger, a larger basis, maybe even nationally, but areas that are kind of have impact, whether they're funding, whether they're legislation, whether they're whatever that might be out there. So moving out there, and we've all got a bit of as leaders, a bit of a finger on the pulse of those things. So that, and then as time allows, then staff report. And so that is kind of, and Sarah will do a written staff report each month so that it will really just be a matter of clarification, question, comment related to that. So please do take time to read those, because otherwise it's an exercise in authorship that feels not so important if you don't get them read. And then, so we also have, so we did a doodle, we did a Doodle poll for this time of the.
Yeah. So we did a doodle poll, Chris, to get a sense of what day and time would work for the majority of the group, a noontime meeting time. So I did get 7 responses back, and it looks like the first Wednesday of the month at 11 o'clock was the winner as far as everybody responding. I've been talking with Katie Shalley and the judicial assistants about how we can really carve out time so all of the judges can be present. And it was suggested that that 11 o'clock timeframe might be one that we can work with. So this is Doodle poll. We don't have, everybody didn't respond, but of those that responded, the Monday, the first Monday of the month at 11. So I think we need to confirm that that would work for the judges.
Did you say Monday? Wednesday, right? First
Sorry,
Wednesday.
first Wednesday, yeah, of the month.
And I guess what I would suggest is maybe we go with that, and then we just set a review like 3 months on down the road and see if that time frame is still working, because we can move it if it's not and we need to do something different.
I was going to say that I can put a time block on the judge's calendar to reserve that time slot. The only problem is going to be if the judges have a long motion hearing or a jury trial on those days. Best luck is you'll get 2 out of the 3 judges come August, but between now and August, you might be able to get both Judge Peterson and Judge Smeltzer participating in the meetings. So if you want me to go forward with that, I can do that and run that past the judges if you wish.
I think that would be great.
Thank you, Katie.
And obviously, we know that as evidenced by today, that not everyone's going to be able to attend every meeting all of the time, but if we can sort of strive to have that on our calendars and protect it as much as possible, that would be appreciated. So, anything else related to that, Sarah, that we need to tend to? Oh, you
Um,
wanted to talk about, did we want to,
Yeah, so it's kind of at the end of our agenda as far as the next meeting
Oh,
date. So we do have a executive scheduled June 23rd. If we were going to meet the first Wednesday of the month, that would be June 2nd. So I guess just wondering if we want to have the executive meet next month and then have the ops meet starting in July. Because I guess it wouldn't make sense for us to meet again in 2 weeks, right? Or next week, actually, would be
Next
the
week.
first Wednesday of the month. So if we wanted to, so maybe it's just that the ops doesn't meet in June and then we start in July at that 11 o'clock on the first Wednesday. Just a suggestion.
does that work for everybody?
All
All right,
right.
so kind of out of order, but the executive committee will meet on the 23rd of June. Primary function to that is to set the agenda for the CJCC at-large meeting, which will be in July, correct? And again, maybe we'll find that after we do that, there's little purpose to having those two meetings and we just lump them all into one.
Right.
All right. Consideration of actions to be taken by the committee. Letter of support for the Menominee Police Department COSAP grant application. Eric, do you wish to speak to that?
Yeah, sure. Thank you. So the Menominee Police Department is going to be applying for a COSUP grant. In fact, we have submitted the initial application for it and now are working on the final grant plan. And really what that is the COSUP grant is used to address addiction issues in methamphetamine and opioids. It focuses in on using evidence-based practices to divert and deflect juveniles and adults away from the criminal justice system. And in particular, what I'm hoping to do is have a partnership with Human Services, CJCC, our local fire department, and community shareholders to implement what's called a quick response team. And really what that is that's just a fancy terminology for doing home interventions with people who have suffered overdoses or are of at high likelihood to overdose. And this professional team, so it'd be comprised of law enforcement, social services, or therapists, and paramedic would go and visit and basically try to get people into rehabilitation and then help them overcome those barriers by connecting them with financial resources, transportation, and other things like that in order to help them become successful and then develop wraparound services as well. So that way they know that they're in a community of care and can overcome any kind of barriers that come up. That's really the minute and a half elevator speech for what the quick response team is as it relates to the COSUP grant. It ties into our Project Hope initiative, which we've already implemented phase 1, where we've been diverting and deflecting juveniles away from the criminal justice system into other options and have experienced quite a bit of success in keeping some kids in school and getting done. So we've already had early success with that part, and the quick response team would be part of phase 2, which we're hoping to implement in 2022. Or if this grant is awarded, the award start date would be in October of this year. So I'm asking if the operations committee would be willing to vote in favor of drafting a letter of support for this grant initiative. And I'll take any questions if you have it or have them.
And again, it's another opportunity for a lot of money. I think Eric's
is.
writing the plan for 600,000.
It is. It's a $600,000 grant. I've already secured local funds of near $200,000 and utilizing current data along with information from our phase 1 program. I feel we have a pretty good opportunity and a good chance of securing this grant. So it's a significant amount of money that would help provide resources for those persons in needs and also help those agencies that partner with us overcome some of their obstacles that they may have in providing those enhanced services. And the grant is a 36-month grant, so 3 years it would be in operation for.
I make a motion to authorize the chair of CJCC to sign a letter of support on behalf of the organization.
Can I get a second?
I'll second.
Second by Judge Peterson. Any discussion about that? Otherwise, all those in favor of supporting this group issuing a letter of support signify by saying aye.
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 All right, I think we're good to go.
Thank you, everybody, for that support. I hope we can get that. It'll provide a great service, I think, to people in our community.
Yep. Good work, Chief.
Thank you, Judge.
All right, next agenda item number 6, oversight areas. We will hear an update from the Dunn County Treatment Court and the Dunn County Family Treatment Court. So we will start with Janae for treatment court, adult
All
treatment court.
right. Unfortunately, she had to run off with a sick child, so
Oh,
it was
no.
pretty abrupt, but I did get a report. Unfortunately, I didn't get a chance to review it, so we're gonna go through it together. I'm gonna try to share my screen here. And since I have 2 screens, we're gonna see how this goes. Here we go. And then how do I bring it over here? Okay. So can you see the report right now?
Yes.
Okay, great. Okay, so this is kind of a new effort for us as with this new group to have oversight. So typically we have had a treatment court advisory group and then a family treatment court operations work group as well. So those work groups with our CJCC action a few months ago, we concluded the work of those different groups and really consolidated the responsibility for oversight to this new operations group. So this is our first kind of month that we're going to cover 2 areas. Since May is National Drug Court Month, it seemed fitting to have our treatment courts start us off with the updates. And then certainly we want feedback on different things that you might like to see or information that we can relay. But we'll bring in the coordinators again in about 6 months for another update. But as far as treatment court is concerned, this really is our high risk, high need population in the criminal justice system. And by high risk, it means high risk to reoffend. And high need means there's treatment needs that folks have at a high level in order to reduce that chance of recidivism. So this really is our kind of most difficult clients as far as those that have drug and alcohol issues. It's a very intensive program. 18 to 24 months is typically what it takes for somebody to get through the program. It's based on an evidence-based model for drug courts. And likewise, our family treatment court is as well. And it's really a multi-agency activity. So we've got, the team is led by the judge. So we've got Judge Peterson leads our treatment court. We've got the assistant district attorney, Amber Hahn, participates. Treatment court coordinator is out of my office, so Janae Brantner, who you briefly saw for a little bit. We've got probation. Paul Gilbertson is the agent for our team. Lindsay Fields, our integrated treatment specialist, so she's our expert in substance abuse counselor on my staff. Arbor Place participates, so we've got counselor Jolie Burr. The sheriff's office participates, Marshall Moltoff, our chief deputy. And then we also have Menominee Police, Chris King participates. And then we have public defender Shelley Tomczyk that participates. So as you can see, it really is a kind of across the board team that meets each week. So treatment court is every Wednesday at 8:30 is when we have court. It's open court. So we do encourage people, if you have not seen treatment court, to join us, whether it's on Zoom or in person. But it's its own kind of special animal with its own rules. So, from the outside, it can be a little bit different than the inside. But really, the program is really intended to get people into long-term recovery, get them into the treatment that they need based on assessments, and get them other services that they might need in order to stabilize their life, become productive, get back out to work, and do all the things that we want our residents to do here in Dunn County. So the program typically is very intensive and very challenging for people to get through. So the numbers are, it's a smaller kind of group that come through our treatment court. Treatment court's been around in Dunn County since 2008. So it was really started at the same time as our CJCC, and it's grown and evolved over the years. It certainly is one of the better programs in the state. We have Janae Brantner, our coordinator, was just elected to the board of the State Association for Treatment Courts as a coordinator representative. And they've actually come to us to really learn about our processes and what we're doing. And I know, Judge Peterson, you're even participating in some training opportunities that you're actually facilitating the training on the standards for treatment courts. So there are national standards, there's state standards that we have to adhere to. Training, 40 hours of training per year is what we ask team members to participate in. And it's really to understand addiction and the components that go into that. And then how we can help somebody through incentives and sanctions really start to do more of the things we want them to do and less of the things that we don't want them to do. So kind of looking at some of the stats for 2020, let's see, we got the 2020 year here. So for the full year, we had 23 referrals that came through our treatment court. Only 6 individuals actually started the program. So there can be many reasons for that. Some people are just not interested in the program. Some people might not be sentenced to the program based on other factors. Or they're just not getting started quite yet. Since court cases take a longer period of time to get through, a lot of times the people are referred, but they don't actually start until their court case is coming to an end. So there can be a lag. Ideally, we want to, within 45 days is the goal of somebody's arrest and into a program. So I don't think we're close to that, just kind of based on our design. As far as active, we can at one time have up to like 24 individuals in the program. So typically we rarely see that number of participants in the program. Right now, this past year, it was just 11 as far as who were at the end of the program. So graduates, and, I guess I also want to say this past year has been incredibly difficult for everybody, but certainly this population that we work with, really feeling disconnected. Treatment services were scaled back. Community support and recovery activities were scaled back. So we had a lot more terminations this past year than we had graduations. So as you can see, we had 8 terminations for the year, only 4 graduations. So we're a little bit upside down there. Typically we see 50-50, right? Since we looked over the course of the program's history since 2008, typically 50% graduate, 50% are terminated. And that termination is typically based on new criminal activity, or really just unable to meet the requirements of the program. And the requirements of the program are, coming to court each week, getting frequent drug and alcohol tests, attending treatment, and then getting case management services through our staff. So that's the nutshell, I guess, of treatment court. By and large, we see more men in the program. Methamphetamines tends to be the number one drug that we see used. And we have had the second, I guess, would be alcohol, where we see some folks come through with alcohol being their primary substance of use. Or, the reality is most of these folks are polydrug users. They're using whatever, drugs are available. But typically it's methamphetamines. We don't see a whole lot of heroin or opioid addiction, at least in our participants of the program. So again, Janae had to run out, so I just tried my best just to cover what she put together here. So I guess I will defer to Judge Peterson if he has any additional comments that he would like to make, or Lindsay Field is also on the call if she wants to add anything.
Well, I'd be happy to respond to some questions. I think if people are able to watch a session and then maybe have some questions, I think that might be a good approach. Things don't always go like we want them to go, but it's really quite complicated, but we've all worked hard to get our treatment court where it is, and we're still a work in progress. But it is something that, when you do have success, it really feels like a good thing. And it's disappointing when you have failures, but it's again, the evidence supports treatment courts as being effective in changing behavior and achieving long-term sobriety and recovery for many people. But again, it doesn't work for everybody, like any other program may not work either. Jail doesn't correct behavior necessarily either. And it'd be interesting to compare do a comparison between incarceration and treatment courts, but they go hand in hand, because we do use some incarceration in these programs. But again, I could talk all day, and I don't want to do that. I know this is just a lunch meeting, but I would invite anybody to either, we do live stream it. So you could go to the wisconsincourts.gov website to live streaming courts, and you click on our live streaming link. We no longer live stream on YouTube. We use Daycast, custom live streaming services. So there's no recordings, and we just do that at the direction of state court operations. So today was the first day in a long time. It was a happy day. I didn't have to wear a mask in court this morning because our plan has been approved by our chief judge. So that's good. We're going back to in person. What do we decide? Like June 16th, I think it will be for the treatment court participants. They're welcome to come in person. I mean, I've been there in person every day, every time. So in any event, it's a good program. It's not easy. And a lot of the training that Janae are involved in, I mean, we're still sort of in the planning stages, but we've both volunteered to assist with developing some webinar training sessions. So, but it's fascinating stuff. I think that'll leave it at that. And Lindsay, anything you want to add?
Sarah, I would put you on the spot a bit, but I think you might be able to find this fairly quickly. We did do some recidivism work on looking at the various programming in the CJCC, and treatment court was one of those things. And so we know in terms of the sort of longer term successes, what that looks like.
Yeah, so hopefully everybody read that, my annual report, the 45-page annual report, but it did contain the recidivism studies of the first year. So when we look at treatment court, you know, our stats show that of the graduates, 77% didn't have a new charge at least 1 year post-program. 70% didn't have any new charges 3 years post-program. And then 57% didn't have charges 5 years post-program. So it really, for those that get through the program, by and large, they really do, it drastically reduces reoffending, which is fantastic. When we look at some of the other stats, that it's hard to compare things to treatment courts, because treatment courts are really those that are participants, like I mentioned, high risk. So they've been in and out of jail multiple times. So it's hard to do an apples to apples comparison with jail or treatment court. I would say if somebody's in treatment court, jail didn't work because they were in jail and they're continuing to come back on multiple charges. So, and really that's where the science tells us that, you know, just the pure punishment aspect of the criminal justice system when it comes to substance abuse isn't as effective because it's a disease, right? So that the punishment doesn't always deflect or deter people from that use once the addiction sets in. So that's really where, if we want the crime reduction effect, we want the harm reduction effect, that treatment is so important for these individuals. So it's while they're in the program that harm reduction is happening, but then we're also seeing those long-term effects post-program as well. So did I answer your question?
Absolutely. And our data work group a number of years ago looked at costing out just some simple offenses and what it costs to take them through the system. And if you just think about 57% of the treatment court participants who probably had a lengthy criminal history prior to their involvement, who did not have a new charged offense within 5 years afterwards, that's a significant amount of time. Maybe not savings per se, but redirected time that the system is not spending on processing those people in those cases.
Absolutely. I'd say, yeah. So we'd certainly take any questions that folks would have on the treatment court program, or any feedback as far as what you'd like to see in these oversight areas as we move forward. Well, I guess I'll give one example. So I think one of the challenges that we have across the board is referrals are low. And that's something that the team's aware of and working on. That we have a lot of folks that come into our criminal justice system with drug and alcohol charges, but not that many are actually getting referred and participating in the program. So that's an area that really needs some attention and improvement to make it sustainable. Because if you think about this big team here of folks getting together each week, and if we just have a handful of participants, we're not getting the biggest bang for a buck. So we really do want to have our programs at capacity. If we have the structure, we've got the staffing, we really want to have as many people in the program as possible to get the best benefit to our community.
All right. Absent any additional questions, we will move along. So the family treatment court is in a little bit different position than the adult treatment court. And we have invited our brand new family treatment court coordinator, Courtney Wolf, who is all of 3 days on the job. 4?
Monday, the 17th was my first day.
Oh yeah, so we're in the last week. So yes, 10 days on the job. So she's just an expert at this. Yes. Courtney, do you want to, I put you on the spot, do you want to speak or do you want me to lay a groundwork, or what would you like to do?
It means
Am
we
I
can, like, go
on?
groundwork.
Yeah, Chris, my intention here was really just kind of meet and greet for Courtney. I didn't want
All
to,
right.
give her the responsibility to kind of write up the report. So I did put something together that I can go through, but certainly feel free to add in as
No, have at it.
as necessary. So I'm going to share my screen again. I'm going to attempt to do a new, because what do you see? You're still seeing the new share.
Family or the adult treatment court. Yes.
Yeah. All right, here we go. All right. No. Oh, do you see it now?
Yes.
Okay. I've got
Can
two
you
screens, so I've got like, I
scroll
don't know
it
where
up
anybody is.
though? We don't see the bottom of it. We see there. Oh no, right there. That looks that there. Now we've got it all.
Okay. And I'll send these reports out following our meeting here. So Family Treatment Court, that's one of our newer programs. This was started in 2019 with a state grant. Dunn County was awarded a pilot grant, just one of two counties in the state to really start a family treatment court, get it up and running. So we had a little bit of planning dollars, and then we had some funding for staff. So in 2019, we did planning, but we got it launched in August of 2019 is when it started. So 2020 was really our first full year of operations with our family treatment court. The family treatment court is very similar to our adult treatment court in that it follows the drug court model. It's family focused instead of individual focused, and it's not as much geared towards those factors related to crime. It's more geared towards that family growth and really ensuring that families have the services that they need. This is a collaborative program, just like the other treatment court. But the referrals in this case are coming through our Child Protective Services of Human Services. So that division kind of works with families and parents and investigates when there's accusations of neglect and abuse. So that's how the families become made aware to us. And then they're presented, if it looks like family treatment court would help them in getting the structure, helping them hold accountable to their treatment plan, and then ensure that the kids and the family really have all the services that they need. So it's really intensive. It's very wraparound services. So we're working across divisions. So it's kind of one of those silo breakers in that we're trying to, instead of just silos of services or programs, we're really trying to bring that treatment court or the treatment provider to the table, bring the case manager from human services together, bring in that counseling expert. So really trying to staff a team approach to help these families with, essentially they've got complex needs. The drug and alcohol is, or substance use is, a requirement of the program. And again, if we're able to effectively treat that substance use addiction, we can reduce the chances of child neglect and abuse and them coming back into to the human service system. It is not always part of the criminal system. Sometimes there's criminal charges and sometimes they're not. So it really is related to that family court piece. It's the same judge that, so we got Judge Smeltzer presides. He would also be assigned that family case as well. So on an ongoing basis, he can really see how families are doing and meeting their obligations or, that are part of the disposition order to get that family reunified again. So it's an effective model to really, again, get people into treatment, into long-term recovery, and using incentives and then sanctions to kind of nudge behavior towards more of what we want and less of what we don't want. And like treatment court, there's drug testing 2 to 3 times a week. There's, appointments with the case manager. There's attending treatment itself, whether that's substance use treatment, mental health treatment, parent peer supports, parenting classes. There's a whole host of things that these participants have to do. And again, this is it's a difficult program. We've got participants with really complex needs. So you don't always see the people kind of getting through the program as often as we want them to. In that also, we just started the program. So it takes, 12, 18 months to get through. So I'm going to see if I can move this over here. Otherwise, I'm going to have to look at another screen here. So let's see. Did that carry? Do you guys see that?
No,
Okay.
we still did see the same thing.
You do.
Yes.
Yeah. Yes. Okay. Good. Sorry. So in this report, we do kind of just highlight the purpose of family treatment in court. And again, it's the idea is to really reunify that family, wrap around services, and try to meet them where they're at, but get them to the point of recovery and healthy living. I covered some of this stuff, just how we started. Last year was a major shift in that the pandemic came, we went to virtual, and we're just now talking about getting back to in-person, which everybody's super excited about. But it was a difficult year for everybody involved. We did have some staff turnover. So Derek Smith, who was the coordinator, he left in early May. And as Chris indicated, Courtney started here just last week. So we just had a couple of weeks where we didn't have a coordinator in place. Let's see, I'm going to keep going here. So some of the stats from 2019, we had 11 referrals and 10 of the participants started. In 2020, we only had 6 referrals and 2 new starts for the year. So again, here's the challenge in that we weren't getting the referrals in a way that was really keeping it a viable program. And then only 2 of the 6 were even interested in getting started. As far as the stats, 2 graduated in 2020, and then we have 3 terminations. So that's when I'm speaking of, it's a hard program, and people can, get disengaged from the program if it becomes too difficult, or if it seems like it's not going to materialize as fast as they hoped as far as getting their kids back. But a lot of that really is, we give people a lot of chances to get back on the wagon of recovery. So we're not quick to terminate anybody from either of the programs. At times, there are clear and good reasons to terminate, but we really try to wrap around support to get people into treatment. Because if they're not getting the treatment, they're not likely to be successful in their child protective service case. So we had a number of challenges that we faced last year, I don't think I need to recap that. But, I think moving ahead, we also have some challenges and opportunities. One is just with a new coordinator. So we've got kind of a fresh start with Courtney. It's going to be important for her to get the training and to really start to get some ownership of the program. We did co-locate that, her office down with Human Services. So she's down there, where typically the coordinator's up here in the CJC division. So we're going to give that a try for a period of time to see if we can improve the referrals and really the connection with the rest of human service staff to be really mindful of family treatment court, get those referrals early, identify who needs this additional services and support, and get them started. We also have challenges in just the communication and team building. So we're hoping that Courtney being down there, that can help with the communication piece. Team building is just a team. So it's important that we develop a healthy team and we have open communication. So last year it was a little bit challenging overall, but I think we've got some processes in place and more frequent meetings and communication. So things have definitely improved. Just since the beginning of the year, we've had 8 referrals since January. So we haven't had any in the last month or so, but quickly in the new year, we started getting referrals coming in. It's important for, like I mentioned, the team training in the model. So it's important for Courtney to get that training. It's also important for our judges to get the training, the new judges. So just really pleased that both of them were able to attend the state training that was put on by the Wisconsin Treatment Court Association, because that it really is kind of its own game. So you got to know the rules, you got to know how to handle certain situations. So that training is really critical. We're going to be transitioning again this year with Judge Smeltzer's retirement. So Judge Peterson has kindly been open to taking over that family treatment court, at least for an interim period of time until the new judges get in, and then the judges can start making some joint decisions as far as workload. Which is great because Judge Peterson has a lot of experience. He's presiding over treatment court. So with Judge Smeltzer's retirement, we really shouldn't miss a beat as far as that judge interaction. And that's one of the most important components about these treatment court models is really that frequent interaction with the judge and really highlighting the positive steps that they're making towards recovery. That's part of the magic that comes through that. So I think I will again defer to anybody that's on the family treatment court team or associated with that. So Chris or Courtney or Lindsay or Jim, any comments that you'd like to add?
Well, I just would like to say that Judge Smeltzer and the District Attorney Nodoff, they're doing a jury trial today, so that's why they're not here, just so you're aware of that. But that's all I wanted to put in there.
Okay, thanks. I would just add, when as far as the statistics, as far as who's in family treatment court, we do see more females than males, just a little bit opposite of what our treatment court is. Average age is the same, which is really interesting. It's that mid-30s is what we're seeing on average. And methamphetamine is the most problematic drug that we continue to see in both of those programs. All right, any questions? All right, I'm going to stop the share so we can see you again.
Yeah, I do have a question. Well, maybe I don't know if it's good for this spot, but are we doing open court for the family treatment court?
No.
Well, yeah,
No.
yeah, we are. Well, it's not a closed court.
It's not broadcasted,
Right.
Yes. But it is
not
open court.
It's not confidential like a CHIPS
Right.
matter.
Okay.
Right.
People can come in.
Yes. So you can't zoom in and watch it, but you can come into the court. And again, yes, we welcome folks to come and observe if you are so inclined. And we meet Tuesdays at 8:30 is when family treatment court session is on.
All right. In the interest of time, so what I would propose that we spend the next 7 or 8 minutes, I'm sorry that this is a work in progress for us to figure out the timing to some of this, but that we just spend some time talking about, I know Eric gave us an update of some of the work that's happening in his world. This is an opportunity for us to kind of lump them together, but to just say, are there things now as a newly established group that we would wish to either, that we're struggling with, or areas where we would like to expand to, so that we can start to put together the functioning of this group in terms of leading us forward into the future, and not losing track of the initiatives that we've already started. So I realize that's like really gray, and I'm sorry for that, but
Well, I'd like to, I guess, District Attorney Nodoff isn't able to join us today because of that jury trial, but I know one of the areas that of concern for her is the digital evidence system. So we did receive that DOJ coronavirus grant to get some software. So I think, between the Menominee Police, the Sheriff's Department, and the District Attorney's Office, I think they're trying to and the IT department, really what the best system is. But it sounds like there could be some potential, I guess there's just different, opinions, different software that's available. But I think that's one of those emerging issues, especially with perhaps the mandating of body cameras for law enforcement. Really, there's just this huge volume of evidence that is coming through the district attorney's office. So it's and it's going to only get more. It's only going to increase. So I think that's an area that we're hoping that some of the funding can help out with. But I think there's just some need for collaboration there.
So what does this new thing do? Go ahead, Aaron.
Go ahead.
Oh, I can, maybe the sheriff wants to chime in on this too. Essentially, it's, we would upload our digital videos and evidence onto this website. It's a cloud-based website where the district attorney would have an opportunity to view it. And if they want to seek charges, they certainly can download, copy the information. They can also share with the defense bar too, as having access. So it's, I guess the short version of it is to try to make it easier in sharing digital evidence for all the parties involved. And perhaps the sheriff has some other thoughts on it too, or can provide greater information.
I was just going to add, I think the kind of decision to be made right now is this iCrime Fighter is a completely separate system from our Zerker new software now, which may be coming out with something very similar very soon, which would cost us a one-time licensing thing versus paying for iCrime Fighter, over the next several years. It's a matter of getting the DA's office internet speed at a rate that they would be able to view it through Zerker. And I think that would be our preference, is to stay with the system we have, and it gets downloaded there anyhow, and then we can share that with the DA's office, and then they can share it from there or burn it for discovery. So that's kind of the decision to be made yet at this point.
You guys do both agencies use the same? Both use Zerker?
All agencies in the county use it. Actually, Menominee PD, Elk Mountain, and Colfax, as well as Menominee and us, and the jail, all use Zerker. So that would be ideal if we could get a system that works best through that, and everybody could upload their video to that and share it with the DA.
Yeah, so I think that's just one of the ongoing issues, but it sounds like there's meetings going on. We can use the grant funding for an alternative system if it's an equivalent price tag. But when we wrote the grant, we just had the contract for iCrime Fighter, so that's what went forward. But we certainly have IT's part of the conversation as well. That's where we want to use the funding to support what we need. And I think it's really up to the agencies to figure out what they need and their preference, and then, try to encourage, everybody kind of reaching consensus. So it does make sense, if we're using Zerker to get something more compatible with that existing system. But I think those are conversations that are ongoing, and collaborations ongoing there.
I think I would share that another area that's sort of peripherally connected to the CJCC and moving forward is in the area of housing. So there have been some fragmented pieces of housing movement around the county over the last really few years. And one of those is the Housing Action Team, which is one of the teams of the Health Done Right Community Health Partnership. There was a housing focus to the Stepping Up initiative from the CJCC. There was the city of Menominee had worked with Cedar Corps to do a piece of kind of a small housing study. So anyway, the long and the short of all of that is that there is a resolution going to the Health and Human Services Board tonight to approve, and then it will ultimately go through the county board to approve Dunn County joining in with any of the local municipalities who would be interested in doing a Dunn County specific housing study facilitated by West Central Regional Planning. And looking at kind of across the board, making some actionable recommendations about things that we might be able to do to improve the housing situation in our county. So I know that that impacts lots of different pieces of all of what we do. And so that's moving along. I shared with Sarah before we started that I needed to bow out at about 5:02 because we're being visited by the Department of Children and Families Secretary on the state level this afternoon. So I need to tuck out, but I think we're close to done. What I maybe would ask Sarah is if you would spend a little bit of time with the group just asking for their feedback about what we might be able to do to, being that this was our first meeting, to just say, is there something, what should we do? How do we structure the next meeting? Is there any advice that people have as to how to make it work well?
All right, sounds good.
I'm gonna check out.
Thanks, Chris.
Okay.
All right, well, any ideas that folks might have on the meetings?
You mind just on a little different topic that I just jump in quick? I just wanted to.
Oh, yeah, you bet.
Okay, so the judges-elect and I have been meeting, from periodically, I think almost weekly. And like met with the district attorney last night, and we're meeting with probation with Aaron Cernahouse and some people from his agency next week. If if you or Sarah, I don't know if we, your team would like to meet with us, kind of just an informal meet and greet and talk about stuff generally, just a little bit of get acquainted. We've been doing it on Tuesdays. Some Tuesdays are not available, but if someone wants to, like with law enforcement, the sheriff or police department, just get a hold of Joey and we'll set something up. We've got a number of Tuesdays available. If Tuesdays don't work, then we can look for some other time. But I think this is a good idea for them to have a chance to meet and have a casual conversation before they get into their formal training and under the pressure of having to start. So I just wanted to throw that out there. So anybody that's part of this group that's interested in that, just let us know and we'll get something set up. So thanks. That's all I have.
Great. Thank you. All right, any other comments that people have as far as just updates or feedback on the meeting structure here as we get started?
Personally, I like having the action items up front so those things can get taken care of. And then it leaves more of the meeting for potential discussion or brainstorming or working through issues.
I think maybe we want to limit our oversight areas to 1 a month instead of 2 a month. I think that just gobbles up too much of our time. Important, but it just doesn't give us the time to discuss other things. All right, well, if there's no other comments or feedback, I think that probably concludes our meeting. So I just appreciate everybody's time and attendance. Next meeting might be in person. Who knows? Bye, everybody.